Hello, so today we're going to be going over inserting an NG tube for feedings. This is my patient, Miss Daisy Gonzalez, right here. So first and foremost, we're going to assess the patient for a need of internal feeding because if there's not even an order for internal feeding, then that's an error right there. So we're going to review history of nasal problems, review their medical history, maybe a reason why they're going to be getting this, maybe they can't swallow for whatever reason, so they need supplemental feedings for the time being, but they don't want to go ahead and give a whole G-tube, a permanent G-tube. So we're going to review nasal problems because we're going to be inserting the NG tube through the nose. So if their right nostril is blocked, they're having a hard time breathing through that one, and their left one is okay, you'd want to go ahead and go with the right one so that they have at least one nostril where they can breathe through pretty well. It's more comfortable for them. We're going to review the type of tube needed, what's ordered, and what we're going to be putting in the patient and how long it's going to remain there. We're going to assess for a gag reflex on our patient because that's going to be important later. You want to make sure our patient doesn't aspirate. We're going to determine if prokinetic is needed before administration. The doctor may or may not use this. And we're going to also take bowel sounds. We want to make sure that the stomach is actually absorbing what we're giving them, and we're not just pumping them and it's just building up inside of them. So before any procedure, we're going to wash our hands, perform hand hygiene, and identify our patient. So in this case, Ms. Gonzalez, I wouldn't say her name. I would knock and go into her room, and then I would ask her name. So, can I have your full name, date of birth?
Yes, Daisy Gonzalez, 3/11/97.
Okay, and that is on the MAR, on the TAR, and that's gonna be the two identifiers I need to go ahead and feel comfortable doing this and know that it's my right patient. So we're gonna explain the procedure to the patient. We're gonna position our patient. We're gonna gather our equipment. We can place a towel over. We can place a towel over the chest of the patient and provide tissues as needed. And for the positioning, we're going to position our patient upright, high Fowlers if they're in bed, or if they're sitting down, just straight up like this. It'd be easier to get the tube in without them being slumped over. We're going to determine the length of the tube and mark it with tape. So to determine the length of the tube, I would grab the distal end of the tube. I would do it from my nose to my ear, and then from the ear down to the xiphoid process. And that right there would determine the total length of the tube of what we're gonna about to need for the patient. And we'd also prepare the fixation device and pH paper to. Once we feel like it's in the right place, we can test the pH, determine if it's maybe some gastric contents, and that's where we want it to be, is in the stomach. And because it can easily go into the lungs if you don't do it right, and that's why we need to confirm placement. That's why we have protocols like we can actually view it. We have the patient open the mouth, and that's why we need to assess the gag reflex too. And that's why we have the patient swallow, because it helps facilitate the tube to go into the stomach instead of the lungs. Alright, so now that we have our supplies ready, positioned our patient, verified that it's the right patient, performed hand hygiene, applied clean gloves, everything's ready to go. We've confirmed the order, the correct tubing we're going to use. We're going to go ahead and facilitate insertion of the tube. So first and foremost, we're going to lubricate the tube. That's going to help the tube slide more easily down into where we need it to go, because it being dry could actually irritate and hurt our patients, like the lining of their esophagus. So to insert it, we're going to have the patient flex the head towards the chest. That's going to facilitate swallowing, and that's going to help the patient go down the esophagus instead of the trachea. We're going to encourage them to swallow and listen for air exchange. If we hear, listen for air exchange. Once inserted, we're going to perform the measure of gastric pH to verify placement. Before the X-ray. That's going to help determine that we're actually inside of the stomach, because the stomach's going to have the highest pH in the body. And we're going to secure it with our marked site. We marked the tube earlier whenever we measured it. We're going to mark the site and the importance and secure it. And the importance of doing that is that we can see later if you marked it right here and later you see the mark is way up here, you can tell that maybe the tube has kind of came out a little bit and you may need to advance it a little bit or let the provider know. And we'd also secure it to the nose and the gown, have two forms of securement just to make sure that it's as safe as possible and as it's not going to move. Once we've done that and we feel like it's in the right place, we're going to obtain an X-ray, which we're going to do for any tube placement, make sure it's in the right place, because if it's in the lungs, we can cause aspiration pneumonia, infection. It'd be hard for the patient to breathe. If it's too much, you want to avoid things like hypoxia. So part of our ongoing assessment would be inspecting the nares and asking the patient if they're comfortable. You don't want their nares to have breakdown. You want to try to keep that patent. We're going to observe for difficulty breathing. Difficulty breathing could indicate that it's possibly in the lungs instead of the stomach. And then we would need to let the provider know. And gagging as well. You don't want the patient gagging. You also auscultate the lungs periodically to make sure that there's no wet sounds, new advantageous sounds. It would just be part of our ongoing assessment. As far as documenting, we're going to record the type of tube used, the location, the patient response to it, and we're going to document the confirmation that the X-ray did confirm it, that it was in the right place, and signs and symptoms of aspiration. We're going to monitor for that. And other than that, that's what we'd be doing as nurses in our interventions, and that's all I have to do.